Good evening, everyone. On the behalf of Team Dentist Channel Online, I would like to extend a very warm welcome to all of you. I'm Dr. Aditi Mishra, and I'll be the host for today's session on the topic Introduction to AI in Healthcare by Dr. Nivedita Tiwari. So, before starting the session, I have few housekeeping notes to make. If you have any doubts during the session, you can put your questions in the question and answer box in your control panel, and each and every question will be taken up at the end of the session. If you have joined us from Facebook and YouTube Live, you can ask us questions by commenting, and we'll be answering that question after the end of the session. And this webinar is sponsored by Novamind Implants. Without further ado, I would give a brief introduction about our today's speaker. Dr. Nivedita Tiwari believes in empowering innovation in medicine and spearheading the AI revolution in dentistry. Built world's first instant oral hygiene screening platform that uses power of AI to screen oral hygiene status and recommend the best dental care. Currently, she's directing clinical operations at Logy.AI and clinical AI projects for government of Telangana. Over to you.
Thank you, Aditi, for this wonderful introduction. Hello, everyone. And thank you, Dentist Online channel, for bringing us all on this platform and discuss and giving us this opportunity, to discuss great topics that is changing the scope of dentistry. So, like Aditi said, that I'm Dr. Nivedita, a clinical head at Logy.AI, which actually builds innovative AI healthcare products, and I also manage multiple clinical AI projects under government of Telangana. So today's topic is AI in healthcare, medicine/medicine. So via this presentation, today we'll address some, buzzing, trends that is happening in AI and in healthcare in general, and whether AI is an enabler or an inhibitor. So we will be addressing all these issues. So I'll just quickly share my screen. Shall I, Dr. Aditi?
Yes, absolutely.
Okay. My screen is visible. Uh,
Yes, it
yeah.
is.
Okay. So hello everyone and welcome. So when we talk about AI, why we I feel that there is an emergent need of the AI in medicine is firstly, and why especially healthcare workers like us need AI is firstly upskilling, a requirement of professionals to be updated with latest technology. So as we are moving forward in life from a primitive to more evolved human being, we have to think of innovative ways how we can do the same thing in a different way. Second is AI is the skill of the century. So, be it any big companies, Microsoft, Google, they are just looking for. Is my video visible, Dr. Aditi?
No, it's not. Can you? I'll just fix this. Just a second.
Yeah. Yeah, I can. Yeah, I think my video is visible, right?
Yes, now your video is visible, but the screen is not being shared.
Okay. Just
Perfect.
okay. Yeah. Can you see my screen and video?
Yes, now, yes, absolutely.
Okay, great. So second is AI is the skill of the century. Why I say that? Because emerging companies like Microsoft, Google, Amazon, they are looking to build AI solutions and they are looking for healthcare professionals to come and join their team. So they have recently even opened up so many positions for doctors at level of CEO. So, not a year, not a decade, a century, artificial intelligence is one of the emerging technologies that is going to mark in every industry that is ranging from fashion to finance. Being futuristic, of course, because the future of work involves automation. So, as we evolve, as we go forward in our life, we have to understand that automation is going to come and automation is just going to help us. It's not going to take our work away. It's just going to ease our task. Then latest trend, rapid modification of healthcare with AI has been happening, especially post COVID. Then again, I would say need of digital practices. Now, you saw in COVID era, especially dental care, it was highly compromised because people could not, visit their dentist. Forget about visiting, even taking a consultation online was so difficult because a doctor cannot see exactly what's in the patient's mouth. And to everybody's surprise, the world has seen massive innovations happening in industry that that can happen at home. Treatments or digital consultations, everything that
Sorry,
can happen at home, they have
sorry
come
to
up.
interrupt you,
Yeah.
doctor. Your presentation is
Hello.
not visible. I'm really sorry to interrupt you, but the presentation is not.
Oh, okay, just a second. Yeah, is it visible? Is it visible?
No, it's not. Just a black screen with loading sign.
Oh, think some connection problem there. Hello.
Yes, doctor.
Okay. I'll just share the screen again. Okay. Is it visible now?
Yes, now it's there.
Okay. Is it visible?
Yes, absolutely. Please continue.
Okay. So, need of digital practices, like I said, that post-COVID era has seen massive innovations coming up, and at-home treatments that can be given to patients have also come up. Interdisciplinary careers. So, there is an ever-increasing competition that has come up, and there is a requirement that we can, cross-collaborate with domain. So, this is not the time when you will do what you have to do. Basically, it's not this. This is an era where you can explore, you can imbibe, you can combine, and you can create something. That's what I believe, that this is an era for that. So an ever increasing competition needs innovative ideas. So to give better care, we need more innovative ideas, we need better technologies. So, what is artificial intelligence? If I tell you, artificial intelligence is just about replicating human senses. So it has actually started with first very few senses like eyes, speech, hearing, sound. These senses are something that AI can replicate and create solutions. So traditional algorithms that were used were just taught how to do things. So basically, if you want to use a computer, create a file or something, make a document, you just write it down, and that document is created. Basically, you are controlling the computer. But nowadays, the what AI algorithms are doing is they are actually self learning, uh, and they are divided into three lines. First is artificial narrow intelligence. So narrow intelligence basically is like a example is a calculator, where you put in some number, and then automatically it adds and gives you a result. So these are systems which just have one specific task to do. So that comes under artificial narrow intelligence. Second is artificial general intelligence. So how the general intelligence will work? For example, if you see a cat and you see a dog. So a human, how does a human see when they look at a cat and a dog? They differentiate in their brain the ears, the color, the eyes. So those differentiations are there. So AI can work on those terms when given to them a picture of a cat and dog, and it actually correctly shows what is a cat and what is a dog. Then it's using a general intelligence. When we see artificial super intelligence, it surpasses the human intelligence, means it's much more intelligent than a human. It can work more better than a human at all kind of work. But right now, currently, in the industry that is going on in AI, we have started with AI, narrow intelligence, and we are slowly moving to artificial general intelligence. But to attain a super intelligence is something still a futuristic thing to look at. So, what is AI and what is clinical AI? So there is an AI. AI is of course a technology, but what is a clinical AI? Is when you apply artificial intelligence into field of medicine, and AI applications that has the potential to prevent disease, detect any changes in patients, medical condition, diagnose patients faster, individualized treatment plans to patients. So in clinical AI there are few things that has been explored, specifically prevention of disease. How do we prevent something? By identifying it at an earlier stage, detect changes in any patient's vitals that can happen, then diagnose patients faster, give a diagnosis way faster than can a doctor do, or maybe assist a doctor so that doctor can give a faster diagnosis. Individualized treatment plans, for example, with coming up of precision medicine and participatory medicine, which talks about giving a patient the right treatment at the right time, and that has to happen every time. So these terms have come up where they show that AI can actually give us that kind of liabilities, or that kind of privilege. So then we have examples of AI applications in radiology, dentistry, pathology, about which I will discuss in the subsequent slides. So basically, if you see AI application in healthcare, they come at two levels. First is product innovation, and second is process innovation. So in product innovation, you basically create a product, a system, or software that is currently being used, for example, in radiology or X-ray that has come up. Process innovation is when you make a process. For example, a patient is going through a process where he takes his phone, he books your appointment, he comes to your clinic, or a doctor takes a pad, writes, takes his pen, writes his all the case history. That is called as process innovation. Means you make a process easier. So how can you make a process easier? You can digitize the stuff. So there are multiple AI products available which work at these two levels. Then how are actually AI products built? How do you build an AI project? Basically, first you identify the problems. So there are so many problems in the healthcare industry that needs to be solved. So you have to identify the correct problem. So because there are so many problems out there, that we have to figure out which problems are best to be solved. Now there is a method for that also, which I will talk about in the next slide. Then you basically collect data. So first you have to collect data, any kind of a medical record or images, X-rays. If you want to solve a problem in lung diagnosis, or you want to solve a problem for OPGs, automatic reading in OPG. So you have to collect this data. Or if you want to automate medical record writing, then you have to collect a lot of medical records. Once this data is collected, annotation of this data happens on a software. So there is a machine learning automatic platforms which actually takes all this data, and then a professional sits and draws these inbounding boxes, if you can see. Okay, so then we make this inbounding boxes on those images, and we fed this data into the computer's mind. Then the computer will create an algorithm. So just like a human brain, when we are in our medical college, we look at all these images, and we kind of differentiate between different kinds of cancer or different kind of oral condition just by looking at the image. So if we will know, what is the dental caries, we will know what is leukoplakia, we will know what will be oral submucous fibrosis. So just by seeing images, we have some gross idea that, yeah, this is how one condition is different from the other. This same technology the computer uses with these annotated data, which is done by professionals themselves, and then it will create an algorithm inside its mind, and after that a final product is built. So, AI domains are basically four in nature. First is computer vision, which aims at working as good as any human eye. So, for example, a lot of doctors have, with good years of experience, they develop a term which is called as clinical eye. They develop a clinical eye in themselves. Means if the moment they see a disease, they can identify that this is this disease. This comes with practice. This comes with simple diagnostics. You can do that. For example, you can identify caries by seeing an OPG or by seeing a digital photograph. So a computer vision works at this level where it can work as good as any human in identifying a problem just by seeing the image. Then comes natural language processing. Now, classic example of this is when you write an email and you see, automatic suggestions are coming to you, right? So they are actually processing your language and then recommending you to complete the sentence. Then again, some automatic chatbots have come up where put in your symptoms, and they recognize those symptoms, and then they will tell you that okay, you might be having some kind of a problem. Then comes speech recognition. Now, classic example is Alexa, which actually you give some command that okay, play the music, do this, do that. Speech recognition comes in there. In medicine, I would say there is a tool that has come up, which is speech to text AI tools, which actually works in clinical settings, where a doctor can just call out whatever the findings he have found in a patient, and that's automatically gets converted into a text and gets stored in the doctor's computer. And then robotics. So robotics again is it has started coming up, like drones that are coming and delivering medicines, or various kind of other deliverables that has come up. So robotics basically deal with those kind of things. So the question that I was asking you, that how do you identify a problem? Where do you really want to use? When a humans can perform the task in few seconds. So we don't want tasks that takes a lot of time, because then that will make the machine to learn the problem slow. So machine will learn it very slow, and AI projects usually take some time to be fully deployed. When it's impossible to write down the rules. So, what does this mean? For example, a patient has come up with cancer, or I say a non healing ulcer. How do we know just by looking at the patient's mouth that this person is a cancer? We cannot. We'll have to take in a lot of factors. We have to take his history, his tobacco history, his age, his gender. So many multifactorial things come up when we diagnose somebody with cancer. We have to take a biopsy. So there are so many steps involved. So when do you use AI? When you can help the person to reduce this number of steps and land up to diagnosis at an earliest. A third, and most importantly, when it's possible to collect some sample data. So when you can collect a number of whatever problem you want to solve oral cancer problem, you must have oral cancer data with you. So, and always ask, is AI really needed to solve this problem? So like I said, you have to put in these rules. We cannot put AI everywhere. So how such AI projects happen? So they can actually take you to a year or so to develop such projects. So successful AI projects can take 12 to 24 months for successful deployments. So we start with data collection and standard. There are multiple steps over there where a medical professional is needed. Data labeling and annotations. So where a doctor will sit on the computer and label all this data. Then we create an initial AI model. Now this initial AI model is like a baby. So a baby, who just starts walking, he cannot walk perfectly, right? In first few months, he will take some time to be able to, walk and run in a period of time. So similarly, AI will start, and then it will slowly, we need to improve and improve, work on it, improve the accuracy, and then it will slowly start giving better results. So then we perform lab-based initial trials called as clinical trials. So basically we take this product and we deploy it in a hospital or a college, and find out how accurate this model is. Then retraining the model to achieve better accuracy, performing again field trials, and then finally you deploy it. So this takes you around 12 to 24 months. how do you judge if the AI model is working perfectly? So, there are multiple formulas that are put up called as precision, recall, accuracy. So, if you see all these terms, true positive, what is false positive, false negative, so these are some terms that come up. So in true positive is a condition when I say by seeing an image that this is a cancer, being a doctor, the AI also says yes, this is cancer. If I say, then that is true positive. If I say that this model is this image does not carry any cancerous lesions, and the AI says that no, it carries, yeah, it carries, then this is a false positive. So similarly, and then false negative, if I say it's present and the AI says no, it's not present, then it is false negative. So all these parameters are used to, create a formula and find out the accuracy of the system. Now, again, the data, if you see, which we collect, consists of three types. First is training data, which you train the model. Second is validation, which is again, you run this model on this data sets to see how well it's performing. And then test data is just like when you go and give your exams. You study everything, you read everything, but one day you have to sit and give your exams on a complete new set of questions. So exactly this is how AI is also developed. So, coming to this question, where a lot of people said that is it an AI is an enabler, or is it going to steal our job? So, I have this answer to them that AI works at multiple levels. So, there is human out of the loop system, there is human in the loop system, and human on the loop system. So, medicine. I know a lot of people are, throwing this. Is my screen visible, Aditi? Hello. Am I audible, everyone? Okay, okay, thank you. Thank you, Neetu. Sure. My screen is visible, right?
Yes, it is, doctor.
Okay, sure. So a lot of people say that AI is going to replace our job. AI is going to take away our work. So I would say AI is being since I have worked in this project and I have seen how such projects are deployed and seen the kind of this the problem that AI is trying to solve in the healthcare industry, and with the kind of risk it involves, the risk of telling somebody that you have a cancer, and what if that person doesn't have a cancer? That's going to cause a lot of psychological problems to that person. Seeing this, analyzing this risk, various industry experts have put AI into the second category, which is human in the loop system. So AI, so please note down my sentence that AI, if it's coming in medicine, it is going to be in the loop with the human. A human is going to supervise it. A human is going to confirm it. So for example, in very advanced things, now for example very simple things like I am taking a case history, and where I just talk and talk, and there is a system which is recording my voice and automatically writing down the test. Yeah, that is okay. That is good, that is helping me, that is helping me to automate my task, that is making me to make my job easier. So in that in a case AI is very good. But yes, if it's a very serious risk taking opportunities out there, human will never be out of the loop. The human and AI will work together. So how does AI work here? It can probably, like, for example, the one of the use cases that I am doing with government of Telangana is we want to send this model in hand of field workers who go to all the remote areas, collect images, and if there is an alarm of some kind of abnormalities in the mouth, that person is noted down, that person name is recorded, and that person record will be referred to the doctor who is sitting in the city. So this is how such systems need to work. So some common use cases is like screening or diagnosis, for example in image or sound, decision support system, for example prescribing of medicine, predictive insights like mapping of disease progression or occurrence. So screening or diagnosis, like I said, screening just to understand if to prevent a disease, because I personally believe that only way to prevention is an early detection. So let's detect. AI can be used for that, where a human cannot give service to, and at all levels of problems. We can definitely, like the way the Indian healthcare system is working is it's very reactive, that when you develop some problem, then you come visit us. When you have a pus in your mouth because of caries, then you come running to the clinic. The patient is not being educated to come to you at a very initial stage when he is having an incipient caries, because he's not aware of that okay, this black dot is inside my mouth, this is something I should be concerned about. The patient is waiting for a pain to come, and then he wants to visit the clinic. So this attitude of ours needs to be changed. This is called as changing from reactive to proactive care. This is where an AI can be used to create awareness, to tell people that okay, you have shown some initial signs of a problem, please consult, please visit a doctor. Decision support systems, multiple examples are there. For example, if again, here we don't want to replace anybody, it's just you take a number of factors, like I said, oral cancer, you take the age, you see if age is ever 50, you see there is a positive tobacco history, the AI will recommend that, yeah, this can have some 70% chances of oral cancer. This will help the doctor to take out all the factors and, give an argumented decision. Predictive insights, again, when we are dealing with epidemiology, where a vast number of people are infected and we want to understand what is the progression of this disease, how far it will go, how many people it can affect. So these kind of things can be a very good use case in terms of predictive insights. So this is one of our projects which we built at Logy.AI, which takes images of oral cavity with a smartphone and automatically will help you detect caries, missing teeth, crowding in teeth. So this way, the end user gets aware that okay, I have some problem in my mouth which I was not aware of, and I should consult a dentist at earliest. Then this is an OPG. So in OPG, multiple companies, especially in America, are working on this, in United States of America, where companies which are working on OPG. So in OPG, they want to take automatic detections. So this is again just an augmentation to human diagnosis, not an individual independent body. Then AI enabled automatic cancer detection. Like I said, that this is a solution that we are developing at Telangana government, where we give this mobile phone to the technicians or the field workers, and they can go to every part of the village and screen a patient's mouth. And if there is if the system is recognizing anything suspicious, so an alarm goes on, and the doctors are record this thing, and they take a follow up with the patient if he has taken the surgery or not. So multiple smartphone based clinical AI projects, first like oral hygiene screening, then there is again cataract screening, which is again a similar use case like oral cancer. Again, a lot of people, especially in villages and in remote areas of the country, are not aware that they have cataract, and cataract is a leading cause of blindness in the country, with a huge amount of funds being given by government of India for surgery of people, who cannot finance their surgeries themselves. But these funds are not they are not able to reach to these people due to various reasons, because a government doesn't have a system where it can record how many people actually have cataract. So such systems help government to know that okay, this is the kind of this is the area which is showing the number of people with cataracts, and then subsequently deliver the resources. Then in the hair analysis, where we use a smartphone and lens to screen the scalp of a person, understand the hair density. So thank you very much, everyone. If there is any question, doubts, please feel free to ask me. I'll be more than happy to answer. Thank you.
Thank you so much, Doctor. So, moving on to the question and answer session. Before that, I have a small presentation for all our participants, and I request all the participants to kindly drop your questions in the question and answer box so that we can take up each and every questions after this my presentation. Meanwhile, Doctor, I would like to seek your permission to introduce our speakers to introduce our participants to our organization. Sorry for the technical glitches. Okay, so this is our organization, Dentist Channel Online, with the motto Healthy Smiles That Leads to Wealthy Lives. I request all our participants to kindly save this number and send your name on this number as a WhatsApp message so that you're added to the broadcast list and you'll be updated about each and every upcoming sessions that we have. So this webinar is sponsored by Novamind Implants. Novamind offers a full spectrum of implants and prosthetic solutions that accommodate any clinical need in modern implantology. Novamind successfully supply highly demanded dental implant types called internal hex, tissue level, bone level, and active conical connection. Their EU production unit and product quality is appreciated worldwide. Dental implants and dental restorative solutions produced maintaining all the standards of EU medical device regulation. Products are manufactured in Athens, Greece, and distributed worldwide with more than 1 million happy restorations. So let's quickly go through the upcoming dental webinars that we have. And for more info, you can visit our website, events.DentistChannel.Online. So these are the webinars that we'll be having next week. On 19th of October, we're having a nitty-gritty about the endodontics by Dr. Shikha. On 20th of October, we're having on legal aspects part 2 by Advocate Sushant Samudrala. On 21st of October, we're having connecting links between oral cancer and tobacco. And 22nd of October, we're having event by Dr. Garima Goel on, again, errors in endodontics. So tonight at 7 p.m. we're having Secrets of Composite Restoration by Dr. Ahmed Yusuf, and Dr. Sara will be hosting it. If you haven't subscribed to our Prime membership, I request you to do it ASAP so that you are enrolled for e-certificates. Plus, you can avail a lot of benefits like you can avail discounts for our online workshops and a lot more. So it will cost you this, the annual membership will cost you just 499 rupees. So kindly do it ASAP. You visit our website or www.dentistchannel.online. You can follow us on Facebook, Instagram, Twitter, and YouTube. So now quickly moving on to the question and answer session. Okay. So should we start, Dr. Nivedita?
Yes, yes, please do.
All right. So first question is by Dr. Neetu. She's asking, how do we determine the size of the data sets? Does it depend on prevalence of disease as oral cancer is not so common?
So basically, like I said, no, it has nothing related to prevalence of disease. So basically, so like I said, that you have to decide when you like. Just a second, I'll just share my presentation that will help you understand better. Yeah, is my screen visible?
Yes, it is.
So, so I would firstly not agree that oral cancer is not a prevalent disease, but yes, the data sets definitely you can't find it, that easily. But yes, if you develop these projects in collaboration with hospitals or cancer organizations, then you will definitely have enough of data. So like I said, that when you collect the data, there are three sets how you have to collect. So 70% of the data should come into training data set. So how do you start? You can start with minimum of around 300 data. Try to collect it. Now AI is an ever learning solution, so it will keep learning, it will keep improving. So there is no upper limit, but yeah, from a lower limit, let's start from 300 images. Let's see how the then you divide it into 70, 10, and 20% ratio, and then you see how the model is performing. Once you see that there is there's a lot of ways, that when you collect the data, firstly you have to segregate it into a number of conditions. For example, oral cancer shows so many variations. So you have to collect the data, uh, good quality of data, and always remember that if you put in garbage things or garbage data into it, you will get garbage results. So good standardized data which has been collected in a standardized form, not random, well annotated, and then simultaneously divided into training, validation, and test data sets. And then you keep on increasing, and then you keep on ever seeing and improving your model. Thank you.
Right. I hope Dr. Neetu's doubt is clear by now. So, before ending the session, Dr. Nivedita, any takeaway note for all the participants?
Yes, I have a takeaway note. So, like I said, that if you before the thing, that before starting my presentation, I wanted you all to know if AI is an enabler or disabler. So I personally believe it's an enabler, because I have worked in such projects and have seen that how well it's actually helping both the patients and the doctors. And best way to protection is early detection, and AI is that tool, where we can move from reactive to proactive care. So
Ab-
yeah.
Absolutely. Okay, so we've got one more question by Dr. Mohanty. He's asking what stage of oral cancer is being detected.
Just a second. Yeah, can you please repeat the question?
Yes, the question is by Dr. Mohanty. He's asking what stage of oral cancer is being detected.
Yeah, so currently the model that we have started is suspicious and non-suspicious models. So since you know that in oral cancer there are multiple, just a second. So, in oral cancer, there are multiple stages at which an oral cancer can happen. There are, potentially malignant disorders, there are benign lesions, there are malignant lesions. These, there, since there are various stages, we have actually started with classifying something into suspicious, which will take into all the potentially malignant disorders, benign disorders, and two normal structures. So this is how we have started, and we will eventually keep adding the class by seeing how the model is performing. So this model is still under development; it's not deployed yet.
Right. So, thank you so much, Dr. Nivedita, for this awesome session. And I'm sure each and every practitioner will be benefited a lot with this information. And thank you so much for being with us. Thank you so much for all the participants. Thank you so much to all the participants for patiently being with us and listening the session. And yeah, looking forward for more sessions with you, Dr. Nivedita.
Thank you, everyone. And I just want to say that I have also initiated my, this this journey where I'm also learning, just like you people are learning. It's little difficult to a lot of time to answer all the doubts and all the queries, but yeah, even I am learning, and I hope that as I keep learning, I'll keep sharing my experience, my work with you all. And I request all of you to please stay connected with me on my LinkedIn page. Please reach out to me anytime if you have any doubt, and let's keep this journey as I don't want to show myself that I am the superior one, I know everything. No, let's come together, let's work together, and let's learn together. Okay, thank you everyone.
That's great, Dr. Nivedita. There is one query on Facebook. It
Yeah.
is there any course of AI specifically for dentist?
So I get that question a lot of times, and that is a very valid question that has come up. No, there is no course. There are courses of general courses like AI in healthcare, which basically teaches you about what are the applications. We are currently, because we got so many requests from people, so we thought that okay, let's start with we'll be soon starting a course. And meanwhile, like I said, that keep following me on LinkedIn, and that will also add to your learning process. And we are starting a course. uh, Please ping me, I will share you the details. And once the course is ready, it will be live for everybody.
Yes, absolutely. And you can share the details of that course with us as well, so that if somebody comes up and inquire with us, we can also share that the same piece of
Sure,
information.
sure, sure. I'll do that.
Okay, thank you so much, Doctor, for being with us. So, with this, we'll end the session today. Have a great evening ahead. Thank you so much, guys.
Thank you.